Now, £500 million is being diverted from the Department of Health, savings to help accident and emergency departments in England.
Yeah, the money, which will be spent over the next 2 years, is intended to ensure that waiting times are kept under control. The new 111 non-emergency phone line gets a share of the cash. £15 million will be sent its way after problems establishing the service.
The British Medical Association has said the money is just papering over the cracks. Well, we can speak now to Johnny Marshall, who is Director of Policy at the NHS Confederation. He joins us from our central London newsroom. A very good morning to you. Thanks for being with us. Is it any more than a sticking plaster?
Well, we welcome £500 million over 2 years. It could make a significant impact on patients, but it needs to be in the system early if we're going to get the plans in place for the winter. It needs to make sure it's not just shoring up existing A&E services, but providing alternatives, and it is a short-term sticking plaster solution. It doesn't address the long-term root cause of the problem.
It's £500 million over 2 years, the NHS budget £110 billion. Is it really going to make much difference?
Well, it will make a difference in those areas where we're able to invest the money in coming up with alternatives to A&E services that enable people to be cared for at home, where they'd much prefer to be looked after, rather than having to go in A&E. But it is only a small part of the solution to the problem. It is only a short-term solution.
So what will patients notice then?
Well, I think patients will probably notice different ways in which services are provided. So, for example, in some parts of the country, they already have much closer working between GPs and accident and emergency units. So if you go to A&E and it's thought your problem is more appropriately managed in general practice, you're actually able to book an appointment straight into the GP service. In other places, I think you'll notice social care and healthcare working much closer together in the community, district nurses and social workers, so we can provide more help to support people at home and prevent them needing to go to A&E when they're unwell over the winter.
You say it doesn't do anything to address the root of the problem at the moment. What are the key issues here that are causing A&Es to be under so much pressure?
Well, whenever there's pressure on A&E services, we recognise there's pressure on the whole of the system, whether that's in general practice, district nursing services, social care services. So what we really need to do is have a look at all of those services, make sure we're investing in district nurses, in social care, in general practice services, so we can support people at home in the community and prevent them having to go to accident and emergency in the first place.
Do you see this money as an admission in any way by the government that actually the way the NHS is being run at the moment isn't working?
Well, I think we've had lots of short-term solutions during each winter whenever there's a crisis. Money tends to be invested sort of during the crisis rather than ahead. So we welcome the money being available up front, but it does need to be released into the system very, very quickly. But again, it is only a short-term solution, and we do need to look at fundamentally how we get the services right throughout the year, not just over the winter.
OK. Johnny Marshall, good of you to join us. Thanks very much.
Thank you.